Hi, I'm Sarah. I am 36 years old. I have two children, and I'm actually 34 weeks pregnant with a third. My two daughters are 4 and 6 at this time. I was 6 days postpartum with my youngest daughter and had had pretty consistent pain in my left leg. And after talking to my sister on the phone, she encouraged me to go get it checked out. Just if I had any inclination it could be a blood clot, that I should go have it checked. And I really only thought that it might be because I'd had a friend have a blood clot completely unrelated to pregnancy in high school, and it just felt really similar to what she described. So I went to an urgent care and they did an ultrasound on my leg, and it did turn out to be a blood clot, which was surprising. I was kind of in shock that that's what it actually was. And they sent me home and had told me to take Tylenol. The next day, I really don't know why, but I just felt inclined to call my OB. She's been my OB for 20 years, and just tell her what was going on. So I did that, and she was pretty startled and was asked me to read her exactly the paper, the exact words on the discharge paperwork that they gave me. And then she directed me to drop what I was doing and go straight to a hospital at that time to receive further treatment. So I went to a hospital and was put on blood thinners that I had to give myself in a shot for 3 months. Following that, which was kind of surprising and overwhelming in a lot at the time. This is also right as COVID starting to creep in. So there was a lot happening at that moment. I feel like the gap in my care or education was kind of twofold. I think preliminarily being sent home from an urgent care obviously my doctor considered that an error. So I think it's always important, if you do seek treatment somewhere else, just to follow up with your OB. They know you, they know pregnant women best. And from my experience, they are far more likely to treat a pregnant woman. I've had a lot of different things happen in all of my pregnancies and seen a lot of hesitancy from other providers to treat pregnant women, as I think they're understandably just cautious to maybe do something that could negatively impact your pregnancy. But OBs will treat you to the fullest because they feel the most confident in the answers that they're giving you. I think the gap in my knowledge came from knowing how common blood clots are. So when I was at the hospital, the physician there said, "Oh, this is one of the most common postpartum complications. I'm not surprised at all to see you in here right after having a baby with a blood clot." And I just remember being in shock that a doctor characterized it as so common, but no one had ever mentioned it to me as something to be aware of. So that's what I would encourage you, is to really listen to your body. And blood clots are a common postpartum complication. So if you are having pain, I didn't have any swelling. Typically they'll say oh, is your leg swollen? Or I didn't have any swelling. I just had almost what felt like a pulled muscle in my leg that would not go away. I couldn't stretch it out, anything like that. So it's hard to differentiate the pain that comes just in your entire body from just having delivered a baby and something that maybe goes beyond that. But I think it's really important to listen to your body and ask for help. And it's always better to be safe than sorry, and to just have something checked if something feels off to you. Only you know how you feel. And so I think it's really important to advocate for yourself in those situations, because it's really easy for us moms to fall between the cracks from that delivery date until our 6-week postpartum checkup. That's a really long time, and a lot can go wrong with your health. So ask for help if you think you might need it, even if it feels silly. Always better to be safe.